Hi everyone, I'm back. If you're joining me for the first time, my name is Dr. Ivy Branin. I'm a New York-based naturopathic doctor with a focus on women's health and hormones. So I also work a lot with skin, specifically acne, digestion problems, lots and lots of SIBO or small intestinal bacterial overgrowth, and patients struggling with mood disorders and difficulty falling asleep. If you like today's video, don't forget to like it. And of course, I always highly recommend that you subscribe to my YouTube channel. So today I'm going to be talking about what are the differences between a naturopathic doctor and a medical doctor, or also what we consider either allopathic or conventional medicine. So the main differences, I would say, between conventional medical doctors or conventional medicine and naturopathic medicine is, firstly, with naturopathic medicine, we have much more of a focus on finding the cause or the root cause of the patient's condition versus just masking symptoms with medications. So as a naturopathic doctor, when I'm seeing a patient, whether it's for a headache, whether it's acne, whether it's PMS, fibroids, etc., the first thing I want to know when I have that patient there is, why does this patient have this? Why are they presenting the symptoms? Not so much of a focus on removing the symptoms artificially, but really focusing on what is going on. What is this case all about? And that is one of my main focuses. In fact, I would say that is my main goal specifically with that first appointment, is what is the root cause and finding the root cause. The second thing that I think sets us apart, of course, there's some overlap. I'm not going to say that no conventional doctors are trying to find the cause. Obviously, they're trying to come up with the diagnosis. The other would be a greater emphasis on preventative medicine. So really, what are some of the things that this patient could be doing to either prevent their condition from getting worse, or if they have a family history, say, of hypertension, heart disease, diabetes, what are some of the things that they could be doing differently with their lifestyle, their diet? What needs to be done to prevent future conditions? The other aspect of naturopathic medicine is something we consider like the fundamentals of health. And that kind of goes back to this idea around preventive medicine. Like, what are the fundamentals of health in regards to diet, like healthy eating? And exercise, movement, when we think about how one handles stress management, mind, body, fundamentals of health in regards to sleep. Sleep is so important for health. In fact, actually, I have a whole series if you want to hear all about the science of sleep and why sleep is so important and like what you can be doing to get a better night's sleep. I have a whole series on sleep videos in regards to that. Like sleep, it's kind of crazy, all the different parts of the body that it affects and how important it is. But then also that if we think about how I was saying stress, impacting sleep. So how all these kind of things are kind of coming aligned. When we think about fundamentals of health, like the environment, what is, is the patient in a toxic environment in their home? Like what are some of the products that they're using that could be impacting health? I also have a video on that with Cheryl Pazwater, really interesting video on how to detoxify your home and how to reduce plastics, because plastics unfortunately are a big source of endocrine disruptors or xenoestrogens that can be causing all kinds of havoc when it comes to reproduction, fertility, and just women's wellness in general. So these are kind of all the things that we're kind of thinking, even like within the fundamentals of health, like one's relationships, one's relationship to job, self. These are all part of the fundamentals. The other is how we use, like what we use in our treatment model. And as a naturopath, we tend to use natural therapies to tonify parts of, like the systems that are involved in the condition. So using natural substances to tonify and improve adrenals, adrenal support, adrenal health, to tonify organs of reproduction, for example. So this is kind of like the way what we think about, whether it's through herbs, whether it's through specific key nutrients, amino acids, omega-3. So kind of really thinking of it more in like a tonifying. Then the big thing, and I think I alluded to this in a previous video when I was talking about telemedicine, is time. So if we think about it, if you think about your last medical appointment, the last time you saw a conventional medical doctor, how much time did you spend in the waiting room? An hour, hour and a half, 2 hours? And then in the treatment room, the exam room, maybe you were there 30 minutes, 45 minutes. How much time were you actually with the doctor? 5 minutes, 10 minutes, 15 minutes? So during that whole like 2 hours that you were at the doctor's office, if we even think about like percentage, maybe you were really only with the medical doctor, maybe like 10% of the time. And let's face it, how often have we scheduled an appointment with a doctor and we had an appointment with the PA or the NP, the nurse practitioner, and yeah, maybe they're great. So that's a big key difference. As a naturopathic doctor, I'm spending anywhere in that first appointment, typically about 90 minutes, and then follow-up appointments about 60 minutes with my patient, really hashing out, really educating. And then outside of the appointment, that's not where my job ends. That's when all the research that I'm doing. So there's a lot more time, a lot more attention to detail that you get with a naturopathic doctor. In fact, actually, just this past week, had a follow-up appointment with a patient, and I spent about 30 minutes of that appointment clarifying what her gynecologist didn't explain to her. So it's a big, big difference. So when it comes to like why someone chooses a naturopathic doctor, what are some of the main reasons, and how does naturopathic medicine fit in with conventional medicine or standard of care, regular care medicine? So when I just again think about my own practice, a pretty large percentage of my patients come in because they have a new diagnosis. And with a new diagnosis, it can be very scary for a lot of patients. And it can even be somewhat of a wake-up call. And so with that new diagnosis, again, whether it's a woman who just recently had an abnormal pap and has HPV and cervical dysplasia, and maybe she's even has like CIN 2-3 on her colposcopy and she's freaking out, or also the possibility of endometriosis, another patient who just found out that they had SIBO. A lot of patients in this category, they are wanting to try a lot of things. They're not just doing the conventional route, but they want to see a lot of other practitioners as well. So that's a big part of my practice. The other big part are patients that have been doing the conventional route for a while. I see this a lot with my PCOS patients, polycystic ovarian syndrome, and they've been seeing, and also Hashimoto's thyroiditis, which is a type of hypothyroidism. They just have not found a solution with conventional medicine. Yeah, they've been taking the medications, they've been having the workup, but nothing really is changing, though they are taking the medications. And so that's a big part of my practice. The other is patients that have been doing the conventional route. Maybe the medication is working for the specific symptom that they're seeking, but the medication either has side effects that aren't working for them. So I see this a lot with my patients that are on SSRIs, serotonin reuptake inhibitors. which are for either depression or anxiety. So sometimes it could be like sexual side effects or weight gain, or some patients that are on medications that are contraindicated in some way. So specifically, I see this a lot because I do work a lot with fertility, and so some patients needing to get off certain medications because they're contraindicated in pregnancy. And a few years ago, I did have one of these patients. She had rheumatoid arthritis, and the medications that she was on, which were appropriately helping with her flares, she couldn't take during pregnancy. She wasn't pregnant yet, but she was hoping to be pregnant very, very soon. And so what we actually ended up doing was we found certain foods were her triggers, and by eliminating those foods, her symptoms went down. In fact, actually her flares reduced dramatically. She subsequently got pregnant, had a healthy pregnancy, and actually she still maintains that diet to this day and hasn't needed to go back on medication. So it's kind of like an interesting, because of her pregnancy, she decided to try something different, and now she doesn't even have to be on medication. So another question I often get when it comes to allopathic or conventional medicine versus naturopathic medicine, when to see a medical doctor first. So the classic medical answer or doctor answer to any question is, it depends. I would highly say, like in my practice, definitely a medical emergency would require medical attention first, or conventional medical attention. So, in case of like traumatic injury, for example, definitely want to go the conventional medical route first. Also, the other big thing is depending on where the naturopathic doctor is. So sometimes I feel that it's actually better for some of my patients to get a straight conventional medical workup before coming to see me. So we have like all the labs, all the diagnostic work, maybe the diagnosis. Specifically if it's a diagnosis where it could be in between a few different conditions, that can be helpful going the conventional route first. When I say conventional route first, what I mean is seeing a conventional medical doctor. I always tell my patients this: you always have the option. You can have the workup, and then you can make the decision whether or not to take the medication. And then also the other thing with that is some medications, if you start them, you have to kind of continue them and you can't stop. So one of the examples would be, so I work a lot with urinary tract infections, and very, very successfully actually. But even with that, even though I have a pretty good success rate, I always have my patients, first of all, get tested because it's not always urinary tract infection. In fact, actually, one of my patients was misdiagnosed by her gynecologist, was put on antibiotics for no reason, and that caused a whole other kind of issue. But the other thing is, once we know for sure it's definitely a urinary tract infection, it's always a good idea just to have the antibiotics on hand in case the patient doesn't respond promptly to natural treatments. So typically I will tell a patient, if you haven't had pretty much complete reversal of your symptoms within 2 days of starting, then I would recommend starting the antibiotics, because urinary tract infections, for example, can escalate into pyelonephritis, which is basically a kidney infection, and that's definitely more serious than a standard urinary tract infection. The other would be, it's kind of like within the same realm of this question, I do often get calls from patients that have recently been diagnosed with cancer, and they want to do exclusively natural. They don't want to do chemotherapy or radiation. I personally, this naturopath here, I don't work with patients like that. And the reason being is that if I'm going to work with a cancer patient, first of all, the limitations of my practice is I can help with the side effects, for example, of chemotherapy. I can help make sure that the patient is following good nutrition, and also hopefully help to prevent reoccurrences, because even with conventional cancer treatment, there's always the possibility that it will come back. So that means that I only work with cancer patients adjunctively to their conventional treatments. So, and if a cancer patient is refusing conventional treatment, they're most likely not going to find an oncologist to work with them. And as with most of the conditions I work with, I really prefer that my patients are well monitored. So we know that, what I'm recommending is working well, and also working well with whatever else they might be doing. So that's a kind of a little bit within the realm of that question, but a little bit different. So hopefully that clarified a little bit about the difference between naturopathic medicine and conventional or allopathic medicine. And if you're interested in becoming a patient and starting to work with a naturopathic doctor, feel free to hit the link to book an appointment, or of course you can also always visit my website, simplicityhealthassociates.com, and access the online scheduler there. And also, don't forget, if you like this video, don't forget to like it. And also, we're always adding more and more content to the channel, so don't forget to subscribe to the YouTube channel, because I'd hate for you to miss anything. Okay, well, hopefully you enjoyed this video. Again, everyone, my name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City, and looking forward to seeing you next time. Have a great day.